Okay. Good afternoon, everyone, and you are all welcome once again to another edition of Health Talk on Promise City TV. My name is Abigail Kwe, and I'm your host for today. So, PCTV is a Christian channel which is mainly focused on Christian activities. And so we have a lineup of activities on the channel to help you with your spiritual growth and your well-being. And that is why we also have the health talk on this channel. So just to quickly run us through the activities on the channel so that anytime you are available, you can join us. On Mondays, we have an online Bible studies starting at 7 p.m. Then from Monday to Friday, 11 a.m. is visitation hour with our mother apostle, Mrs. Benis Ajiman Prempe. And every Wednesday from 7 to 8 p.m. is exhortation hour with Irama. And on Thursdays at 4 p.m. is Inspirational Hour with Pastor Jessica. And then every Sunday at 4 p.m. is Health Talk Show. So as I mentioned, from Monday to Friday is Visitation Hour with our mother apostle, Mrs. Ajiman Prempe. She is also the CEO of Promise City TV, and the general overseer and founder of Promised Land Faith Ministries. So for Promised Land Faith Ministries, for our first timers who are joining us on the call, it's located at Tema Community 1 behind the Gold Filling Station. And we have in-person meetings, and you're always welcome to join us. At Tema Community 1, that is one of the temples where we fellowship, which is the Faith Temple. We also have Dominion Temple, which is located at Doyum off the Shire Hills Akosombo Road, and Victory Temple located at Ashiama Atadeka. Anytime you find yourself in these areas, you are always welcome to join us in fellowship. At Promise Land Faith Ministries, on every Wednesday at 10 a.m., we have Faith Hour, which is held at the Faith Temple. Then every Friday, we have Manifestation Half Night, starting at 9 p.m. On the Sundays, we have two services. In the morning is 9 a.m. at the Faith Temple, and then 6 p.m. at the Victory Temple. So as I said earlier, you are always welcome to join us for any of our services in person at the various temples or online for the activities mentioned earlier. Okay, so let's go into today's talk, and we're going to talk about HPV vaccination, human papillomavirus vaccination. There's a lot going on about this. Some months back, we had the Ministry of the Ghana Health Service having engagements with the Ghana Education Service about this vaccination. And today we have a special guest with us on the call, and she is going to give us more insight into this HPV vaccination so that we understand it better and know who it is for and who can go in for it. Okay, so without wasting much time, I would like to introduce our guest for today, and she is Madam Betty Mami Akon, a public health nurse at the Tema Urban Hospital, formerly Tema Polyclinic. And so she's joining us today online to discuss HPV vaccinations. You're welcome, Madam Betty.
Thank you. Thank you so much for having me this afternoon.
You're most welcome. Okay, so today we're going to deal with HPV vaccination. As I said, I read a bit about it and we heard information about the Ghana Health Service organizing this HPV vaccination. But I think first of all, we need to understand what the HPV is, the human papillomavirus. What is it and why is it a public health concern?
Okay. So thank you for having me once again.
You're most welcome.
To go straight to your question, HPV has become, or it's of a public health concern because it is a sexually transmitted infection or a disease.
Okay.
And we all know that production or human beings come into existence through sex. That is when you can produce a human being.
Yes.
Yes. So that is why it is of importance that we talk about this human papilloma virus, because it can only be transferred to your body through sex or through
Okay.
any contact with fluid from an infected person.
Person. Mm.
Yes, that is how that is what HPV is, and that is the means of getting it. So if there is a cut on someone who has HPV, anybody, any part of your body, the same way you get HIV is the same way you get HPV.
Okay.
So HPV simply means human papilloma virus. It's a commonly transmitted infection. That is what I can say briefly about it. We've
Okay.
abbreviated it because of the length
The
of the
length of
name.
it.
It is
Yeah.
very long,
So
yes.
HPV for short. I think we can work with that.
Yeah,
Yeah. Okay.
yes.
And I'm seeing the reason why it's a public health concern. You mentioned there's not just through sex, but when there's exchange of fluids with an infected person, one can easily contact this virus.
Mhm.
Is that correct?
Yes,
Okay.
yes.
So what cancers and diseases are linked to the HPV infections?
Okay. So there are lots of cancers that are linked to, but when we are talking about HPV, uh, when you get anal cancer, you can get anal cancer.
Oh,
They are linked to HPV, vaginal cancer. So all the cancers of the reproductive organ, most of
okay.
them are linked to HPV virus.
Okay. So it's
Most
not
of
only
it.
limited to the cervical cancer.
No, 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 no. You can get the anal cancers, the vaginal, before you get to the reproductive system, before you
Mhm.
get to the cervix,
Yeah.
you have a pathway from the
Yes. But
vaginal,
then into the
yes, even
cervix.
from the orifice, even
Mm-hmm.
from the pubic itself to the orifice and then to the vagina before it climbs to the cervix. That occurs around all this part of the reproductive system.
Okay.
It's most of the time caused by this HPV virus. But when it comes to the vaccine and the cervical cancer that we are talking about,
Mm-hmm.
when HPV comes in different forms or types, we have the type 16 and 18. These are the types that are really, or these are the types that causes the cervical cancer, if I
Okay.
may say. That is what research has proven that
Mm.
it causes the cervical cancer. But let me say that almost all sexually active people will be affected at some point in their lives. So far as you are sexually active, and if I say you are sexually active, then that's meaning those that have started having sex,
Sex.
you
Okay.
can be exposed to this virus I mean in a point in time. But one
Okay.
interesting aspect of this virus is that I always say that HPV virus is like when you have it, you have a
Mm-hmm.
second chance. When I say you have a second chance, I'm simply saying that the first time you are exposed to this virus and you are able to stay away from the source of your infection, that is whoever is giving you the infection.
Infecting. Yeah. Yeah.
Yes, the virus can go away. Is it not
Oh,
miraculous?
that's a
Yes, it can.
miracle.
Yes, it can through no treatments or anything, it can go away. That is when you don't expose yourself again.
Continuously.
That
Okay.
is continuously exposing
Mm-hmm.
yourself to unprotected sex with infected
Mm-hmm.
people. Because we should know that a lot of people have the virus. And so when you
Yeah.
have unprotected sex with a person and the person introduces the virus to you, the virus keeps multiplying, gaining strength, gaining roots, and then it
You'll
starts
be adding
invading your
more
cells.
more
Yes,
siblings to it.
yes. And it predisposes you to all these
Okay.
cancers. But before then, there are signs. When you start getting vaginal warts, it is the HPV virus that is causing the warts. Most of the
Mm.
time, a lot of ladies, get warts, even the men as well. With the ladies, we see them easily because ladies are very observant.
Mm-hmm.
Because the least thing we want to
Change.
see
You
or
want
know
to
what
see
it
what's
is, and
going
they are
on.
ready to complain, come to the hospital to tell your doctor. But when it comes to the men, they don't complain. Sometimes it will be with them for a very long time. They'll be applying all sorts of things. Most of the time, the men the wax appears on their penis,
Mm-hmm.
around the penis. So you see, you know what vaginal warts are? They look like cauliflower. That is the exact example I can. So when you
Okay.
picture how cauliflower look like,
Mm-hmm.
we all know cauliflower. It's
Yeah.
a vegetable.
Yeah.
Yes, that is how vaginal warts or warts looks like. So this is a
Okay.
sign that when you have you are exposed to HPV and you start seeing vaginal warts, you start seeing discharges, you don't have to
Mm-hmm.
sit in the house because a lot of discharges are not as a result of candida or bacteria or fungi. You have to come to the hospital to run labs or to take swab to find out what kind of infection is
Section.
causing the discharge.
Mm.
So this is a little I can say for now.
Okay. Okay.
And then to come back to did you ask another question before this?
No, so I asked about the cancers and diseases that are linked to the
Oh,
HPV
yes.
infection.
So and I said most of the cancers that
Yes.
are related to HPV are the vaginal, the anal, the scrotal, all the cancer, most of the cancers that occurs in the reproductive system.
Okay. And this just came to mind. Is it also linked to testicular cancer or that's on a different side?
Pardon me?
Is it linked to testicular cancer? Cancer of the
It
testicle?
does, even the throat as well, because
Oh,
now the youth are more of very explorative. They
mm-hmm.
do all sorts of things. So most
Okay.
of the throat cancer is caused by
Mm.
this HPV
HPV.
virus. Yes.
Wow. So it means the men are not exempted from it.
Everybody,
Everyone.
everybody, not just the men, everybody is not exempted. Even our children that they are in the womb, a mother can
Oh,
transfer this virus to the baby during childbirth. When the mother has vaginal warts and she's delivering, yes, that mother can transfer this virus to the baby. That is how come most women, when they get pregnant and we find out through examination that they have vaginal warts, we do not allow them to give birth, but we do operation for them.
operation to take
So
out.
most of the
Mm-hmm.
CS we do is not purposely because the mother cannot give birth on her own. Maybe the mother has an infection that
Infection.
you
Mm.
can't
Can
do
easily be
anything than
transferred to the baby.
to do the CS, yes,
Okay.
to
Okay.
protect that
To
child.
protect the child. Okay. That's well understood. Okay. So when I started with the introduction, I mentioned that I've seen the ministry, the Ghana Health Service, organizing rolling out vaccination for girls. Why is it important to vaccinate at that young age?
Okay. Thank you. It's very important to target this group because from 9 to 14, I mean, you don't need data to tell you that most of these people haven't started having sex because they are very young. So that is the right time to protect them from 9 to 14. Majority of our youth, of our children are basically in that age group.
Range.
So, and we told you that it's a sexually transmitted
Transmitted
infection. So
infection.
if it's a sexually transmitted infection and these people are not having sex at this time, then
Mhm.
we need to protect them from this virus within this age bracket. That
Okay.
is why we are targeting those, I mean, children. It is not only girls that it is not only girls that we can vaccinate. Boys can also be vaccinated.
Yes, because you mentioned
It is
they carry the HPV.
yes,
Okay.
and transfer it to the girls and vice versa.
Mm.
It's expensive. The vaccine is very expensive. Currently, those that can afford it, even the cheapest you can get anywhere is between 900 cities and
Wow.
1,000 cities.
So it's not for free.
So yes, that is
Oh.
the cheapest. So the government cannot afford vaccinating all our
Oh.
children. Yes,
Mm.
it will be very expensive to do that. But because of the statistics, the data or the number of cases,
Mm. Please, you are muted.
I'm
Okay.
saying that apart
Mhm.
from the costs and the age group, data or statistics is informing the action of this government. The number of women that are getting cervical cancer is increasing.
Increasing, yeah.
And it is very scary because we all know that early detection saves lives. But when it comes to our country, we are not moved by that slogan.
Mm-hmm.
We are rather moved by seeing before attending the
Attending
hospital
to
or seeing the signs. But we don't go to the hospital to say that, oh, let me come and check whether
mm-hmm.
I'm fine. Let me go and check my cervix. Let me go and check my womb once in a while to find out whether everything is doing well. We don't do that. And even when we see it, sometimes we lose guard.
Yeah.
So even the age bracket and the cost of it is limiting the government to just target children or women. And you know that the future of every country is how do I put it? The future of Mother Ghana relies on our girls
Yeah.
because they are going to continue the next generation.
Mm-hmm.
So let me put it in short. It is the cost. But I always, wherever I go, I tell people that if you have a male son and you can afford it, you can
Okay.
vaccinate them. Take them to any government hospital, not any government hospital, the bigger ones like
Do have.
Kolebu,
Mm.
Rage, IMA. Let the child run the test. And then if the child is not exposed, you can vaccinate the child.
Okay. So you just mentioned tests. What kind of tests they have to run before they are given the vaccination?
Oh, because when it comes to the children between the ages of 9 and 14, we can say that as for them, they don't need any tests because they are not sexually active. But if
Okay.
you are sexually active,
Mm.
they will take your blood sample.
Okay.
And they also have that is what we call the human papilloma virus test. So and
Mhm.
then they can also do a pap smear. The
Mm-hmm.
pap smear, they take a sample at the service
Swipe. All right.
to take it to the lab to find out whether you've been exposed to the virus already. So
Mm.
basically, it is a blood sample that they will take. And then if it's a woman or a young lady, they can also take a swab from your service.
Mm-hmm.
It's very uncomfortable, but since you know what you want and you are
The
preventing it,
benefits.
I always advise people that it's uncomfortable, but you still have to do it because you just have one life to live and you have
Exactly.
the means to protect it. This is the best way you can.
Yes. Prevention is always better than cure. So
Yeah,
I
yeah.
definitely agree with that. So for the young ladies and the women who have been sexually active ones, because you also mentioned earlier that surprisingly, if the person is not in continuously having sex with an infected person, miraculously the virus dies out. So for someone who had been sexually active once, what's the duration to which the person can say, okay, I've not been active for, say, a year or two. Do I still need the tests or I can just go in for the vaccine with this knowledge?
We don't have any duration. You just have to do the test, and that is
Okay.
all. Just do the
Once you've been
HPV test.
sexually
Yeah.
active, you have to go in for the test.
Yes,
Okay.
do the test. Yeah. If you
Okay.
do the test and you don't have the virus, you can vaccinate.
Vaccinate. Okay.
Even if you are 40 years, you can vaccinate it. Just that we know that after 40, the exposure no. There's- But if you are sure of yourself, I
Mm-hmm.
mean, between that age range, you can just do the test and vaccinate.
And then you
That's all.
okay. And is there a one-time vaccination for life or you have
No,
to?
it is not one time. And you have to take 2 shots with a monthly interval. So you
Okay.
take the first shot. It's
Mhm.
just like taking the hepatitis vaccine shots.
Vaccine.
That one is 3 doses, but this one
Yeah,
is
it's
two.
just two. Okay.
Yeah, this one
Okay.
is two. So you take it, then the following month you take the second shot.
Okay.
That
For
is
both
it.
men and women.
Both men and women.
Okay. All right. Are there any side effects we should be concerned about?
I can say that there is nothing like in this world, even drinking water comes with a risk. Someone dies as a result of choking.
Mm-hmm.
Someone goes to sleep and they die in their sleep. So everything we do has its risk and effects. But we can say that when it comes to all medicines and vaccines and all this, there are effects, but the effects are not such that we have something we called adverse effects following an immunization, or let's say effects, we call something a coincidental effect. Sometimes your body is just reacting because something new has entered into your
The
system.
body. Mm.
Uh-huh. So those are some of the signs. Maybe you might feel one or two uneasiness, but somebody too will take it and the person wouldn't even have
So
any,
any
yeah,
kinds of
issue with
symptoms.
it.
Yeah.
So when it comes to that, that is all that I can say. But it's not any effect that people. Let me also use the medium to clear people's doubts when it comes to vaccines and vaccination. Because of COVID-19, now we are
Mm-hmm.
struggling with most of our vaccination programs. There is so much of misconception out there. But
Mm.
let me state it clearly that HPV vaccine has been in existence since, I can say, 15 years ago or 20 years ago. So we shouldn't be scared about it. The rich and the people that can afford it have taken it already.
Okay.
Uh-huh. So it is an opportunity for us to grab this one. Myself and my colleagues have been making fun about this thing that if the people refuse to accept it, this one they will take it and share it to our family members.
That's all.
That's why, because
Yeah.
this one we know that at least it is safe. People
Yeah.
have taken it over the
Tried
years
and
and
tested it over the years.
yes,
Mm.
yes, yes.
Okay. Talking about misconceptions, there's this myth that because it's to protect us with regards to our sexual health, does it affect fertility or
No,
your sexual activity?
it's a big no. It's
Mm,
a big no. It's a big no. It doesn't.
it
Not
doesn't.
at all.
Okay. Okay.
Yes.
So that clears the air.
It's just for confidentiality's sake. I mean, people wouldn't come out to tell you that, hey, I have vaccinated, hey, I have vaccinated. No. But
Mm-hmm.
a lot of people who can afford it have
Okay.
vaccinated. Yes.
Okay. Okay.
Because I told you the price, it's 900 cities, so
That's a
900
lot.
cities per shot. So if if
No, not for the
somebody,
2 doses.
no, for one, when you go to the facilities,
Wow.
for one, in 900 cities for one shot. And you are supposed to take
Two.
2 doses to be able to have a full protection. So if they are giving it for us for free, then I think it's a privilege.
Yes. Yes. Yes.
Yeah.
We should take advantage of that.
Yes.
So this vaccination is being rolled out this September. I know of this September. Is it going to continue or it's for a particular period and then afterwards you have to buy?
Yes. Unfortunately, we are rolling it out next month rather.
Oh,
We
okay.
are rolling.
Okay.
There has been another program we are doing. We are starting next month. We've realized a lot of our children are also not being vaccinated against the childhood diseases.
Diseases.
So this week, the whole of Monday, we are going around schools and homes to vaccinate our babies below the ages of 5 years. So
Okay.
we've postponed it to next month from
Next month. Okay.
4th of next month. That is when we are starting the HPV vaccination.
Vaccination. And is it particularly for the girls between the age range? I think I saw 9 to 14 years, or
Yes, it's
all
for only
women?
girls. It's for only
It's only
girls.
girls. Women can afford, so
Yes.
they should go get it. Eh.
Yes. This one, dear, if you make any mistake, you can be arrested. You, the health, the public health or the nurse can be arrested. Oh.
Except for right. Okay.
This one, dear, we don't have a choice. It's just for our children.
Specifically for our children. Okay,
Yes.
so viewers, please, it's specifically for our children between the ages of 9 and 14. So if you have any child around you, please go and give the consent. I think you can touch on the consent part for the kids going in for this vaccination. Hello, Madam Betty.
Hello.
Yes, I was asking about the consent from parents. You know,
Yes.
they are
So,
minors. Yeah.
Yes, most of the schools from tomorrow, we are sharing letters to most of the schools,
Okay.
including consent forms to parents to
Mhm.
agree to this to protect our girls because we all know that a lot is going on. Social media has exposed our children to a lot of things, and it
Information.
is not their fault that most of them are beginning to have sex early. It is
Mhm.
because we don't talk to them early about sex in our
Mhm.
various homes. When it comes to African mothers, that is the biggest challenge we have. We talk about everything, but we are not
But
able
not
to talk
that.
about sex with
Mhm.
our girls. So we want to use this opportunity that as much as our children are going to be vaccinated, we should start also talking to them about the effects of having premarital or early sex, the consequences it comes with. Yes, so consent forms are going to be given to a lot of parents. A lot of parents are also are on WhatsApp groups in their schools. So we'll be putting some of these letters
Okay.
there so that at least they'll be privy to it and be aware. Already we've gone on one or two radio stations to
Mm-hmm.
talk to the people about it, to inform the general public about it. So pardon us if we don't receive any letter from us, but we are from tomorrow, we're going through all the 51 or 52 schools in Tema West, Harcourt to be precise, to
Okay.
share letters for the schools and for the schools to also give it to their parents.
Exactly. Okay. I even wish we could have PTA meetings aside the radio and TV announcements. Probably someone may miss it. If we could call on the parents for PTA meetings or put a short notice, like you said, their WhatsApp pages to inform them that this is what it's coming on, and even educate them about it. The education should go together with the letters. I believe it would help them understand the situation better and also give their consent for their kids to receive this vaccination. Oh, this is a great work, and I really must applaud the government for putting this together for us.
Yes,
It's really good.
for once, all of us are so excited
Yeah,
about this initiative. With all the things government has done over the years, this is one of the best initiatives that most of us are excited about. And we pray that it continues, and then the next move will be for our boys as
that's
well.
good. Okay. Yeah, it will be good to have the guys also, the boys also
Yes,
vaccinated.
definitely.
I
Definitely.
I I recall an incident. So I used to be in the clinic, specifically the oncology center at Confanoche, and I've encountered cervical cancer patients, other cancers. But the cervical cancer, there was one married woman who came. We were interacting with her while preparing her for one of the treatment procedures, and we asked of the husband. He said the husband has left her. The reason being cervical cancer. I was like, this man is the cause of it. Like he might have infected you and he has left you to this. So I'm really in full support of this vaccination for the girls because it's going to go a long way, protect them. And looking forward, projecting into the years, we're going to have a cancer-free generation. And so I'm really happy about this initiative and I
We'll
fully
send
support.
you we'll send you some of the flyers so that you can also share it for us.
Sure, I'll do that.
Since
I'll
you
do
have
that.
the medium, yes,
Yes, you
on your
also
church
share that.
platforms and as well.
Yes, yes. We can use the church platforms as well to reach out to
Yeah.
everyone, everyone. It's, yeah, I mean, it's free. So
It's
we
very
shouldn't
free.
we
Free.
shouldn't take it lightly at all. Actually, I wish I was between 9 and 14 to go in for the vaccination.
In
But I
fact,
think let me
most of us,
go.
most of us, when we heard it, we say, "Oh, this one there, we've missed it. We wish we
Oh,
were the age group." For now, dear Grace has spoken, so the viruses, even if we've had a contact with it, it has vanished.
it has vanished in Jesus' name.
Yeah.
But I'm
Yes.
really
Yes.
happy for I'm really happy for the girls. And if the government gets to hear this, please, we are waiting for that of the boys as well.
Yes. Yes. Yes.
Oh, this is really
But
good.
one thing that I always say is that we should also encourage the use of condoms. A lot of
Okay.
people are now not using it to protect
Mm-hmm.
themselves from STIs, So we are encouraging the youth. I know that the youth that are listening to your program a lot, they should use it. we know that we've been telling them abstinence. Abstinence is the key, and they are not abstaining. So if you know you are not abstaining, then please make sure you use the condom. But one funny thing about this HPV virus is that if you use the condom, we better say it just protect the penis, but the skin that comes into
It, the
contact.
skin contacts exchange of fluids, so you still get it anyway.
Yes, you still get it anyway because the condom does not protect the whole of your genital
No,
area.
no,
It
no.
doesn't.
The skin to
Uh-huh.
skin contacts, and
Uh-huh.
there's kissing as well. So there's exchange of all. It's only on the reproductive organ part, right?
Yes. Yes. Yes.
So
And then let me also put this thing, this one with the type 16 and the 18.
mhm.
These are the types that are responsible for the cervical
Cervical
cancer.
cancer.
So let me
Okay.
also, yes, we have a lot of type of this
The HPV.
cancers.
Mm.
HPV cancers. And we initially, I told you that the virus, when it gets into you, it might vanish at a point in time.
Okay.
We should also know that there are high risk and low risk. The low risk is when you decide not to have, I mean, an open sex again, and you want to take good care of yourself by protecting yourself. So the high risk is when you always get the
Exposure.
exposure as
Mm.
much as you are exposing it yourself to it, then
It
you
increases your
should know
chance.
that
Mm.
cancer is waiting for you somewhere.
Wow. Okay. Thank you so much for making this point clear. I think I have a question. Maybe you might have answered that. It says, how effective is it in preventing, I mean, the vaccination, how effective is it in preventing cervical cancer and other related conditions?
Okay. Someone is asking how effective it is.
Yes, in preventing cervical cancer.
99. 99. It protects you against the type 16 and 18 cancers. 99%.
Sense. Okay. So please, there you have it. 99% assured is going to prevent you from the cervical cancer. What of the
I
other
would say
related
100%
conditions?
because
99, yeah, we can round it up to 100. Is it the same for the other HPV related conditions?
is it?
Is it also the same case, the prevention? As you said, for cervical cancer is 99%. Is it the same for the other HPV related conditions?
No, so the other high risk cancers that are caused by this HPV,
Mhm.
I can't answer to it effects. There hasn't been any research that I have come across.
Okay.
But this cancer that causes, that is, this, how do I put it? This cancer affects just your cervix. It
Mhm.
affects your cervix, your rectum, your vulva. That is the type 16 and the 18
18.
HPV.
Okay. So that's the
This is the
99%
vaccine. Yes, this vaccine is pertaining to
to that
just this type of cancer and the part of the body that it affects.
affecting. Okay. So for the oral cancers, that we can't say it's 100%,
Yeah,
99% effective on that. Okay. All
the
right.
oral cancer is part because most girls and boys are doing the oral
I
sex
know,
of
right?
late. So
I know,
the
right?
HPV can still be transmitted through
Mm-hmm.
your mouth to your throat. They can hide anywhere in the glands.
Mm,
But I'm not saying that all the cancers that
exactly.
if you see somebody getting throat cancer, I
It doesn't
can't say that the
necessarily
person had an
mean
oral sex and
exactly.
then was
Yeah.
introduced to HPV. So let me clear that
We,
as well.
we have a lot of head and neck cancers from the head
Yeah.
right down to the
Cancer can
toe.
affect any
Any
part
part.
of your body
Yes.
except one gland. Cancer can affect your eyes, your hair, your eyelashes, your cuticles, everywhere, except one gland that cancer cannot affect.
Okay.
Yes.
Which gland is that, please? Can you help us with that?
I'll tell you later. It is
Not on the call. Yes, please. Yes, please. Okay. I think we've touched on the myths. So what role can our parents and teachers and also people in the community do in supporting this program, the vaccination program?
okay. So one role I encourage our community members to play for us is to spread the news for us.
Mm-hmm.
is to spread the news. They should spread the news for us so that it will make our work easy, to make our work easy. When it comes to the schools, when it comes to vaccination, some of the schools, when we even go there, they don't even want to open their doors to us at all
Oh,
because
no.
they are scared that parents haven't consented to
Okay.
this, and if anything should happen to any child, they might sue the school and all that. We want to tell them that this vaccine is safe. It is very safe. So we beg them. They should even inform teachers, parents about it on their school platforms. They should put it on it for us. Churches, community members, we beg them, they should just, I mean, tell parents to avail themselves with their children, their girls, so that when we come to their schools and even the community, we are praying that even parents will be so much enthusiastic about this site that we can do this vaccination in the schools, because that is where we will get most of our girls,
Okay.
except the children, because we know in Ghana, every child between the age of 9 and 14 should be in
In
school.
school. Okay.
Yes.
Yeah.
So we are hoping to do this in our schools. We will only come back into the community when we have exhausted,
The
or
schools.
we've gotten access to all the girls,
Okay.
and we beg parents that they should allow their girls to take this vaccine because it is safe. It
Okay.
is safe.
Thank you. Please, the vaccine is safe. It's been tried and tested for more than 10 years. So let's be encouraged. Let's understand this and then help protect our future because this generation, they are our future. Okay, so what's if a parent or any young lady or woman out there wants to go for the vaccination? When, how can they access it?
For now, when we start the pilot program, you can only get it in the government hospitals.
Okay.
Tema Polyclinic, Tema General Hospital, International Maritime Hospital. You can get it there. These are the places that you can get when it comes to Tema.
Okay.
Yes. And then I'm talking in terms of Tema how crew to be precise. Yes. But when you go to other facilities that are government accredited facilities, you should get these vaccines for free. And note, do not pay any money to any health worker because it is free.
It's
It
free.
is free. I know that people might rush for it, and then people would want to bribe people at
Mhm.
the end
So that they
because
can
we
have
all know how expensive it is. We know how expensive it is, but we beg the public, people shouldn't pay any money for it. It is free.
it's
It
free.
is free.
And for the young ladies and women, please let's be responsible adults. We have to pay for ours. Let's leave
Yes.
the subsidized or the free ones for our little girls. Our little girls.
Yes.
I think we can
And
do.
then let me also use the medium to tell our young girls that they should be focused. They should keep
Mhm.
focused on their education. They should study hard and become who they want to become, because the number of teenage pregnancy is
Mm.
becoming alarming. We are pleading them. Most of our girls in secondary schools, most of our girls in our communities are becoming pregnant, and we beg them they should avoid early sex or premarital sex. We beg them,
Okay.
and stay healthy for us.
All right. Okay. Thank you. Thank you for that word. That's also very, very important for us to take note of. I think I have another question. It said, what should parents do if their daughter misses the scheduled vaccination day? So say they've taken the first shot and they miss the next one. It said that it should be at one month interval, right? Yes. What if they miss?
Pardon me, I didn't get the question.
So what should parents do if their daughters miss the vaccination, the scheduled
They
vaccination?
missed the vaccination. Oh, they
Yes.
should just come back to the hospital. They
Okay.
should just come to the hospital. They should come to the hospital. They
So
shouldn't
they
worry.
can for them. Okay.
Our
And
doors are always
always
open. They shouldn't worry.
okay.
Okay.
Yeah. And then what if the person have taken the first shots and I missed the date for the next shots? Is it going to
That
affect
one,
them?
the parents would have to afford it. They should be able to afford it because, I mean, if you've missed it, I don't know how, but If the guy, if I mean, if you missed it and we still have some left and you come, we'll give it to you for free. But if we don't have it, then
Then
the
you have
parents should
to.
be able to afford it.
Okay. Okay.
Parents should be able to
All
afford it.
right. And my next question was going, I think you've started talking about it already. That's beyond the vaccination. What other preventive measures are important against cervical cancer? You talked
Is
about
the
the
use of
abstinence,
condom,
the
as we
condom,
said. Yes.
and then
And then
abstinence as well.
abstinence.
Yeah,
Abstinence is number one.
it's number one. So we are
Mhm.
advocating for abstinence, please, young girls. As Auntie Betty said, focus on your studies, focus on your studies, and be who you want to be in future. Don't let this distract you and bring about a disease. I mean, trust me, cancer is something you wouldn't even wish for your worst enemy. So please abstain and protect yourself. And if you've been sexually active, as said here, please try going for the test and then get the vaccination done to protect yourself. Okay, I think our questions are done here. So, oh, thank you so much, Auntie Betty. It's really been a wonderful discussion. I've learned a lot, though I've been in the health sector for some time. I've learned a lot today, and I'm grateful, especially too for accepting our invitation on a short notice. Thank you so much. Thank you very much. Any final message to our parents, our young girls, for the entire Ghana?
Okay. The little I can say is that we need to break that barrier of
Mhm.
us not talking to our girls and our boys about sex. We should let them understand that it is part of our life, and it is not their fault that at a point in time they have that edge. It's hormonal fluctuations that they have, and it doesn't mean that they should go and do it. When you have the edge, command your body to be still.
Mhm.
Tell your body that this is not the time for me to do this. And we should be able to break that chain. We should talk to our girls. Before my girl went to her first, she's in JHS 1. And I spoke to her about it. Don't allow any boy to touch you. Don't allow any boy to say that I want to do this, I want to do it. We should be able to talk to our girls and our boys. Please, parents. Now they have the information already. They've seen it on social media. It
It's
is up to you
everywhere.
to reinforce it and echo it in their ears. And we should be good role models. We shouldn't be watching things on TV with them. There are soap operas and other things that our parents are watching with their children. They are all not advisable. We should rather encourage our children to read their Bibles, stay focused, and learn hard to become better children in the future that we will be proud of. And we also want to tell the community that previously, when you are walking in dark or you are doing something, someone could correct you even though they are not your parents. But now it is not like that.
Mm-mm.
So parents and community members, please, we want those things to come back into the community, to protect our girls and our boys. There are lots going on, and I know that I'll have the opportunity to come back again. A lot of our girls and our boys they have HIV, and they're not even telling their parents about it.
Wow.
Yes, because they don't want their parents to know, and it is their right. It is their
Yes,
confidential
that's
right.
all right. Yeah.
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 So you can't tell their parents. So this is what is going on. You might be in the house with your child, and your child might have a disease that you are
Mm.
not even aware. So
Mm.
please, let's continue to advise them and pray for them. And we
Most
hope that
important.
Ghana will be great again with a healthy population.
Amen. Amen. Thank you so much, Auntie Betty. Thank you so much for making time with us today. And thank you. This wrap up day, I don't have anything else to add to it. All I would say is, as she said, you can, if the TV is not giving you the right information, please tune into PCTV. We have the right programs for you. The Bible studies on Mondays, the inspirational talk, the exhortation, music. I mean, you need the right atmosphere around you. I think they taught us this thing way back in school that when you have those sexual urges and all that, you can go out, skip, go for jogging, and then it takes your mind off. But now all those information is gone. It's not given out again. Once you have the edge, they're like, oh, you need to try it. But no, that shouldn't be the case. So if you need the right information, the right content, TV content, please tune into PCTV, and trust me, you'll definitely be blessed. Thank you, all my wonderful viewers, for joining me. It's always a pleasure to have you join me in the studios on Promise City TV Health Talk and interacting with us. Thank you, Madam Betty, once again. I can't stop thank you for
You're welcome.
making the
It's a
time with
pleasure.
us. Time away from your family, spending this time with us. It's deeply appreciated. Thank you so much.
You're
Okay, so
welcome.
as we wrap up, I'll just like to appreciate our sponsors. So we have ABBA Partners, who is also the sponsors for Your Salvation is Now Crusade. If you want to be part of ABBA Partners, you can call the number on your screen, and definitely you would know what to do to become a partner and to support the crusades. We also have Benbeni Travel Consults sponsoring us, and they are into travel documentations. I keep talking here, there, and there about passports. Please, if you don't have a passport, do get it. You don't know when a travel opportunity will come your way, and you have to be scrambling for it. So do get one. You locate them at Usuforiko Mall. Their number is also on the screen, which you can call them and get the information you need. Lightest Media, you can call them for all your photography, videography, and printing needs. It could be also branding of items or any graphic design services that you need. You can call them. We also have Rope Automations, who are specialists in batch making machines. If you need repairs done or maintenance done on any of these automated equipment, you can call them. You can also find them at Amasaman Ajin Kotoku. Amasaman Ajin Kotoku. Then we have Prissy Logistics. They are into freight management, import and export, door-to-door delivery services. They are located at Temakom 2 behind the Hunch Catering Services. We also have Decovas Enterprise. They provide decor for all events. Any event at all that you need decor for, please call them. And if you need gifts wrapped for you in a nice and a unique way, call them. Anything linked to decor, events, wrapping of gifts, just call them. You can also meet them at their premises, which is opposite to the Tema Community 2 post office. Last but not the least is Crash Makeovers for all your professional makeup, hairstyling, wig. If it's a new one you want, or you want your old ones revamped for you, they are just a call away. Okay, so once again, we say a very big thank you to all of you for joining the program and supporting us every Sunday at 4 p.m. Thank you for partnering with us to make this a success. And also thanks to Madam Betty for joining us on the show. As always, PCTV is committed to providing you, our viewers, with the information and the resources needed to make an informed decision concerning your health. Your health is your wealth. Your health, sorry, is your wealth. So see you same time next week at 4 p.m. on Health Talk Show. I have been your host, Abigail Queen. It's bye for now.